Hello, my dear students. First of all, I would like to welcome you all on behalf of DBMCI MDS experts. This is Dr. Pooja, your original guru of biochemistry. Now, today we are going to discuss NEET GT 12. So, let's see what kind of questions are asked. Now, see question number 1. A 3-day-old neonate presents with vomiting, poor feeding, irritability, and a mousy odor to urine. Lab shows elevated phenylalanine levels. The likely diagnosis is. Now, this question we have discussed so many times in the class also. Whenever we talk about a mousy odor, the only thing which comes to our mind is mousy odor means, and they have mentioned phenylalanine levels. So, mousy odor is due to the accumulation of this phenyl acetate. And phenyl acetate, which is related to the metabolism of phenylalanine, because what happens is that this phenylalanine is not converted into tyrosine because of the deficiency of phenylalanine hydroxylase enzyme, leading to phenylketonuria. So there is increased concentration of phenylalanine, so it will be diverted to form phenyl acetate. So vomiting, poor feeding, and mousy odor is due to, it is a characteristic feature of phenylketonuria. Plain and simple, the deficient enzyme, if we talk about this, answer is C, and the deficient enzyme here is phenylalanine hydroxylase. So the explanation to this question is correct, clear to all of you. Moving on to the second question. A patient presents with black discoloration of urine on standing. He also has bluish black pigmentation of ear cartilage and ochronotic arthropathy. Which enzyme is deficient? Now, whenever we talk about cartilage and ochronosis, this is an example of ochronotic arthritis. And we know that ochronotic arthritis means ochronosis. It is nothing but Alkaptonuria. Because the urine is also turning black on exposure to air due to the formation of Alkapton. So here the deficient enzyme is, what happens is homogentisate is not converted into malonyl acetoacetate. So there is increased concentration of homogentisate, and the deficient enzyme here is homogentisate oxidase. So automatically increased concentration of this will lead to the formation of Alkapton type of substance, and it will lead to ochronosis. So ochronotic arthritis is an example of Alkaptonuria. The deficient enzyme is homogentisate oxidase. So here the correct option is A. Tyrosinase deficiency leads to albinism. Phenylalanine hydroxylase, just now we said it leads to what? It leads to phenylketonuria, and Alkaptonase is not an enzyme. Clear? Moving on to the third question. A 7-year-old child presents with lens dislocation, developmental delay, and marfanoid habitus. Lab shows increased homocysteine in blood and urine. Whenever there is increased concentration of homocysteine, we call it as homocystinuria. Now we know that homocystinuria is of two main types. One is your classic homocystinuria, second is your non-classic homocystinuria. And if we talk about the reactions, what happens is this homocysteine needs to be converted into methionine on one hand and needs to be converted into cysteine on the other hand. So here we can say B9 or B12 is there, and here B6 is required. So if this enzyme is absent or this enzyme is absent, there will be increased concentration of homocysteine leading to homocystinuria. But here the 6, if we see the features, lens dislocation is there, ectopia lentis, developmental delay, and marfanoid habitus. So these all are conditions of classic homocystinuria where supplementation of B6 will be required. So here we can say that vitamin B6 will be the answer. This because this is your classic homocystinuria. Very, very important to remember. I hope it is clear to all of you. Then moving on to the fourth question. A child develops megaloblastic anemia despite adequate folic acid supplementation. Urine shows orotic acid crystals. Which enzyme is deficient? Now, if we talk about this question, there is a confusion between, I know there must be a confusion between ornithine transcarbamylase and orotate phosphoriboside transferase. So, beta, just keep one thing in mind. This is an example of orotic aciduria. Because orotic aciduria mein the deficient enzyme is your OPRT, orotate phosphoriboside transferase, because there will be a decreased UMP or pyrimidine synthesis and it will be totally unresponsive to folic acid, because if you remember, this UMP is required for the synthesis of thymine and that requires folic acid. So decreased, unresponsive to this. So here you can say the correct answer will be orotate phosphoriboside transferase. Now why not CPS1? Because CPS1 में एक तो no orotic acid will be there first of all. Right? If we talk about ornithine transcarbamylase, no doubt orotic acid will be there, but no relation to megaloblastic anemia. And if we talk about arginosuccinate, this is altogether a different enzyme. Isme to there is no orotic acid at all. No orotic acid. Okay, so here we can say the straightaway answer is your C. Then moving on to the fifth question. A 10-year-old boy presents with irritability, self-mutilation and gouty arthritis. सबसे पहले तो boy. That means it must be a X-linked, and baki rest is clear from the question itself. Irritability is this, self-mutilation. We all know that self-mutilation, X-linked, it is none other than your Lesch-Nyhan syndrome. And we all know that Lesch-Nyhan syndrome mein the deficient enzyme is HGPRT. So obviously the answer will be this, which is your option B. And these are very straightforward questions which we have discussed so many times in the class. If we talk about adenosine deaminase, it leads to severe combined immunodeficiency syndrome. If we talk about xanthine oxidase, it leads to gout. And PRP synthetase also leads to gout. But here in both the cases, there is no self-mutilation. Right? Then moving on to the next question. A 6-month-old infant presents with hepatomegaly, cataracts and failure to thrive. Urine is positive for reducing substances even after excluding glucose. So likely enzyme deficiency. Now if we talk about this question, सबसे पहले तो he is a 6-month-old infant. Infant के लिए the mother's milk is the one. First of all, we know mother's milk is rich in lactose. If we talk about lactose, the only thing which comes into our mind is the metabolism of galactose. Now we know galactose mein there are two. This galactosemia is actually of two main types. If we talk about galactosemia 1 or classic, and second is non-classic. So classic mein, if we talk about the deficient enzyme, it is your galactose 1-phosphate uridyl transferase, or we can say that transferase, so it is GALT, and here it is GALC, galactose kinase. Now here the most important one is liver will be the one which is affected and the cataract will be there. So we can say jaundice and cataract will be the main features of GALT deficiency. GALC mein there will be only cataract, no jaundice. And that is what is written here. And excluding is positive for reducing substances. Galactose is a reducing sugar. So here we can say the answer will be galactose 1-phosphate uridyl transferase. And this is an example of classic galactosemia. I hope it is clear. Very simple question. Okay. Then moving on to the next question. A child presents with irritability, tremors and delayed wound healing. His diet is deficient in tryptophan. Now this is such a simple question. So many times I have told you one important thing which you have to remember is this tryptophan. 60 milligram of tryptophan is required for the synthesis of 1 milligram of niacin. So if tryptophan is deficient or niacin synthesis will be impaired, and defect in the synthesis of niacin leads to pellagra, which is characterized by 3Ds. Diarrhea is there, dementia is there, and dermatitis is there, which finally, if not treated, leads to death. Right? So here it's like aankhein band karke you have to go for B3 or niacin. I hope it is clear to you. That's it. So this is all about the discussion of your NEET Grand Test 12. I hope the clarification is clear to all of you. And again, if you people have any doubts, you can always ask your doubts on the groups. So wishing you guys all the best. Take care. Bye-bye.